Hello everyone and welcome to a new episode of Kaleido Talks by KMCT, the official video podcast series by KMCT Group of Institutions. Today I'm your host Sara Sajeer. Today we are diving deep into a specialty that's transforming oral health on a global scale. We have Dr. Dhanya Muralidharan, Professor and Head of the Department, Public Health Dentistry, KMCT Dental College, with us to enlighten us on the importance and uniqueness of choosing public health dentistry as a specialty. A warm welcome to you, ma'am.
Hi, Sara. Thank you so much for inviting me to this session of talks. And I'm really excited to be here and to tell you more about my specialty.
Okay, ma'am. So let's start with the basics. So when people hear about public health dentistry, they might often think അതൊന്നെങ്കിലും government work അല്ലെങ്കിൽ community clinics ആയിരിക്കും. So can you paint a broader picture of what this specialty actually involves?
Yes, Sara. Actually, when I was also thinking of choosing a career in public health dentistry, what I knew about the subject was that community postings and camps and government service jobs opportunities. But actually, that is a misconception, and this specialty is actually very diverse. We have, if you look at the basics of the specialty is to try to identify the cause of all the oral health problems occurring in our community and the population.
Okay.
But what public health dentistry has actually evolved all the way to developing, innovations in preventive care. Okay. So even, for example, AI-driven data sets which could help actually predict a disease, for example, like oral cancer. So the scope is very vast. And another aspect of the specialty is that we are not restricted to one single population type. What I mean is the population group that we take care of is very diverse. We deal with children. We deal with adolescents, we deal with young adults, and we also look after the oral healthcare needs of the elderly. Special groups like specially challenged or specially abled individuals. All these different sections of the society actually come under our scope of, caring for their oral health problems.
Yeah, ma'am. So why not just become a regular dentist and help people directly? What would you say to that?
Yeah, that's a very good question. Why not a single dentist who feels like helping the community? They can do the same things. But that is also a misconception. I would like to clear that with an example. If you look at the statistics, nearly 3.5 billion people world over are suffering from oral diseases. This means nearly half of the population are suffering from pain, infection, all the consequences of oral disease burden, including the burden of treating those diseases, oral diseases, in terms of financial costs, loss of working days. Okay, if you look at school children, the loss of their attendance in schools. So this sort of burden is what we have, and we are talking about a huge population. So traditional clinical care is very, very important. But no single individual can actually cater to the needs of such a vast population. So that is the, role of a public health dentist. The only way to control this level of disease burden is through prevention strategies that will target population level programs, basically, that will help to prevent the disease from occurring rather than treating all the outcomes of different disease options.
Okay, ma'am, that's something to think about. Can you just give a concrete example of that kind of impact?
Sure, Sara. Let me give an example which I had during my post-graduation days. So I actually worked with my guide implementing a comprehensive school dental health program at an orphanage in Nellore, Andhra Pradesh. And that is where I did my post-graduation. And there we had implemented a preventive set of programs for these children, which included fluoride mouth rinsing, Pitt and Fisher sealant program, periodic health education sessions for the children, and even screening for dental health problems and treatment also was provided in that project. And what we found at the end of 3 years, by the time I reached my final year, was that there was a definite reduction in the oral health problems of these children. We found reductions in dental caries and gingivitis, which was the major problem that these children faced. So all this came down, and only through mainly, looking at prevention. So this sort of a strategy was so beneficial. And definitely when you're looking at underserved populations like orphans, you'll understand that they cannot afford the treatment of these diseases. So that was something that really impacted me and gave me a good real-time picture of how we can use population-level strategies to overcome the disease burden.
I guess there are a lot of people who can't afford dental care. So I guess this is the only way that dental care can reach to them.
Yes, that's very true, Sara.
Yeah, okay, ma'am. So now let's talk about the educational pathway. How does postgraduation in public health dentistry actually look like?
Yeah. So if you look at the course program, and it is a 3-year program that the postgraduate training is all about. And the students have both academics, including the theoretical part, as well as the practical component. And in the training program, the theoretical part, they focus on, public health concepts, that is epidemiology, biostatistics, policy and evaluation of different public health programs. And when they also have to study dental specific concepts like dental public health, oral epidemiology, prevention, fluoride sciences, etc. Now, apart from the theoretical concepts, the most important part of the training program is the real-time exposure they get in the community settings. So here, the postgraduate students will be a part of planning for community oral health improvement. So they will go to as a part of our village adoption programs. They will target specific underprivileged groups like inmates of the jails, tribal population. And in all these settings, they will learn to plan to improve the oral health of these underserved individuals. So what you have to understand is this goes on at a community level, not at an individual level. And apart from this, I would just like to tell about our special program that we have for postgraduate students in KMCT, our Department of Public Health Dentistry. That is, we also have a training for exposure in the field of palliative care. Now, this program is undertaken by collaborating with the Institute of Palliative Medicine, Kozhikode. And here the students will get exposure to managing the oral health problems of people who are chronically ill and terminally ill. So here what we want the students to actually achieve is that be more empathetic, develop their communication skills, and try to give a holistic sort of care for such individuals. So this is a special part of their training program at our college.
Okay, ma'am. So you've been doing quite a lot of community-oriented services. So adinalla recognition kittunundo?
Yes, I would definitely say that all these initiatives, it's done over a period of time. And a few I would like to mention is the recognition we received from the Ministry of Health and Family Welfare, Government of India, and the National Resource Center for Oral Health and Tobacco Cessation for our activities towards creating awareness about oral health in the community and our anti-tobacco activities. So that sort of recognition actually reflects our commitment towards improving the oral health of our community.
Okay, ma'am. So that's a great exposure for aspiring postgraduate students.
Yes.
But I guess there is always a concern. അതായത് എത്രമാത്രം clinical skills develop ചെയ്യാൻ പറ്റും ഈ ഒരു specialty focus ചെയ്താൽ. So can you please elaborate something on that?
Yeah. That's very true. I guess that is always a concern, that when we are always talking about public health dentistry, it's all about community level outreach programs. But I'd like to, change that misconception too, because provision of individual care is also a main part of our training program. So our postgraduate students will be posted in satellite centers in both rural and urban areas. So here they will be able to manage the dental problems of all the patients that come to these satellite clinics, which means they will provide comprehensive dental care. That includes, all the restorations of their decayed teeth, or doing scaling, oral prophylaxis, provision of root canal treatments, provision of crowns and other artificial prostheses. Everything will be done in a single clinical setting. So that is one of the benefits of having a real-time clinical exposure and you get that exposure in a single clinical setting.
Ma'am, that's interesting. It sounds like there is a wide range of clinical training being carried out in your department, isn't it?
Yes, Sara, that is very true. See, apart from the basic dental procedures that the postgraduate students will do, which is a part of the Dental Council of India's part of the course program for public health dentistry, the students will also be, we will also be providing an advanced clinical training module in their course. So, for example, we will be providing a basic implant sensitization program where the postgraduate students can actually come to an understanding of the theoretical concepts, the diagnostic aspects, and also the radiographic interpretations that are needed as part of implant planning. And they will also get a comprehensive knowledge of the various implant systems. Apart from that, they will also be trained in the practical aspects of implant by hands-on in artificial models. So this is one program that we included apart from the basic requirements for the course as per the council, and this is to improve their scope in provision of care in the advanced clinical practice too. And apart from this, we are also focusing on improving their surgical skills by, simple postings in improving the suturing techniques, minor surgical procedures like transalveolar surgeries, and, managing medical emergencies, which are also requirements that any good practitioner should also have. And these training modules are actually provided by posting the postgraduate students in the concerned speciality which actually provides these services, healthcare services. And apart from that, within our department too, we will train our PGs on rotary endodontics, and they get to practice that as a part of their program. And because we all know that every other individual has caries, and many are always in a stage where we can't fill it or restore it. So the most common treatment procedure that is done is root canal treatments and placing crown after the treatment. And this has also been done, and time is always valuable for the patient. So rotary endodontics is a big component in today's clinical practice, and that also we will train our postgraduate students. So the basic, if you look at the training program, it has got a dual approach. That is, we want our postgraduate students to excel not only in the public healthcare settings, but also in the clinical practice too.
Also, I've heard research and specialty are important partners. So how do you integrate research into this program?
Yes, Sarah, that's very true. We have our focus on community outreach. We have our focus on improving the clinical practice. Research is the cornerstone of the post-graduation program. So we focus on research on addressing today's public health challenges, oral health disparities among the population, and even innovations in developing preventive strategies to control the current oral disease problems within our population. So if you look at our department, we have been recognized as a Center for Research under the Kerala University of Health Sciences. And so postdoctoral programs are also possible in our department. And one of our focus areas that we've been working on is oral genomics. And we have received a seed grant for the same from our institution to carry out this major project. Apart from that, this year, recently, we have also got the ICMR grant for mentoring a third-year student as part of the DHR ICMR short-term study studentship grant. So research is definitely a cornerstone of our postgraduate program. These students will be taking up research in the areas of oral epidemiology, conducting epidemiological level surveys and trying to understand the cause of newer emerging oral health problems affecting the population. And they will also be trained to evaluate existing oral health programs which have been already implemented. So the training is vast and research is definitely a core area of the PG training program. And also, we contribute to creating a research enabling environment within our institution because we conduct every year the basic research methodology workshop, which improves the quality of the research that postgraduate students undertake. And this we do for all first-year postgraduate students from all specialties.
Okay, ma'am, that really sounds like a comprehensive environment for students who are taking up this specialty. And now for dentists or recent graduates listening, what career paths are available for them?
Yeah, now that is the most valid question because once you complete your post-graduation, definitely you would, you're thinking of the career path. Definitely that is you have to know what are your options after the post-graduation period. So if you look at the scope of public health dentistry as a career choice, you can work with the governments, both at the state and the national levels. For example, in the state level government, you can work along with them to develop, community dental programs. At the national level, you can work with the government to formulate policies to control the burden of oral diseases in the population. And also the Ayushman Bharat program, the scheme is actually increasingly integrating oral health into the scheme. So there are opportunities. We public health dentists, our expertise are being used to design the preventive dental benefit packages as part of the scheme. Also in the field of academics, you see public health dentists can teach oral epidemiology, teach research methodology, biostatistics, all this to budding young dental graduates. And if you look at research, most of the funding agencies, they look for resource persons and principal investigators who have a background in both public health and oral epidemiology, because funding agencies like ICMR and DHR and all that, these agencies, their focus is addressing today's public health challenges. So our expertise can really contribute to, developing and to this field in reducing the oral burden. And if you look at the private sector, for example, dental insurance companies are also hiring public health dentists so that they help them to design the package and scheme where prevention can also be included. And if you like traveling a lot, then you can work with NGOs both within the state or the nation as well as globally, agencies like the World Health Organization and other even smaller NGOs that actually focus services towards caring for the underserved population.
Okay, ma'am, what about public health dentists in the tech innovation landscape?
That's a very good question, Sara. Innovations in preventing oral diseases is one of the key focus areas of public health dentistry of the specialty. And I can give you a few examples where, machine learning algorithms have been designed so that you can use the photographs of the lesions or patients to diagnose diseases, to develop apps that could diagnose diseases like oral cancer. Then simple things like development of wearable, devices that can actually, record the frequency of toothbrushing to make sure that the individual is actually brushing the correct number of times. And even developing newer dental preventive materials, which are more biocompatible and which set faster and is not very technique sensitive. So all these things, you may be wondering, this is there in any other field, okay? But any other specialty of dentistry too. But what I would like to say is the validation of these, devices and products and apps that are coming out. The validation is basically done at a population level, always requires inputs from the public health dentist. So definitely innovations, startups, there is scope for, a public health dentist there too.
That sounds interesting, ma'am.
So basically what happens is that you are not restricting yourself to one area. You have the, diversity to work in academics, work in research, work independently in clinical practice, or go and develop your own startup. And so the opportunity and diversity of the specialty is one of the best things about it. So you can, throughout your career, you can change paths if you're not happy with one aspect of it.
Ma'am, what kind of students are well suited or well fitted for these programs?
Yeah, Sara, what I would like to say is that looking at the diversity of this field or specialty, as I told you, I feel that, any student would find something that they like in our specialty. But definitely, there are certain skills or some students may be, we can say, a little bit more suited for the specialty. So what I would like to say is that if the student is always has been thinking about why disease occurs in the population, what is causing the disease, and they're very interested to work with, in teams to the benefit of the community. They want to create more impact at a community level than at an individual practice. Then I would say that this is a field meant for them.
Okay, ma'am, one last question. What advice would you give to someone trying to decide if this is the right path for them?
Yeah, so the easiest way to help someone out with that is to see if they answer a few questions. Like if you get very excited about understanding the cause of oral diseases in the population, you are interested in working at the community level in teamwork, and you want an impact on the community, your work to have an impact on the community rather than individual practice alone, then, and if you're answering yes to all these questions, I would say that your choice would be public health dentistry. So here at KMCT Dental College, we believe not only in creating well-rounded public health dental professionals, but also skilled clinical practitioners. So there should be a balance in the training between community outreach as well as their skills in clinical practice as well. So I feel that the world needs more of us, who are skilled in both aspects, or I would say in three aspects: research, clinical practice, and community outreach. And there is a desperate need for, people with this sort of expertise.
That sounds great, ma'am.
Yeah.
Thank you, ma'am. It's inspiring to hear about the work your department is doing, and it's truly beneficial taking this specialty.
Thank you, Sara. And to all the aspiring public health aspirants out there, I'm eagerly waiting for you all to join us. Thank you.
Stay tuned to upcoming episodes by Kaleido Talks by KMCT. Until then, it's me, Sara Sajeer, signing off. Have a great day and bye.